Well, hello there. Good evening and welcome. My name is Animwaa Anim-Addo and this is Strong and Sassy on your Superstation Joy 99.7 FM. Thank you so much for being here. I know you could be anywhere, so we don't take it for granted that you choose to stay here and listen to us. So really super grateful for that. We're live on Facebook, so you can go on there and watch if you're not driving, and then you can comment and send in your questions and all of that. We'll be monitoring from there as well. But our studio lines are open as always, for your WhatsApp, your text is 05511119997, 05511119997. Now last week we started to talk about beauty in a bottle. And of course, what we're talking about is the fact that right now, if you can afford it, you can look however you want. However, you can buy hips, you can buy botox, you can buy thighs, you can buy boobs, you can buy a slim face, you can buy a pointed nose, you can buy fuller lips. And this is something that we're seeing much more of more recently. Of course, plastic surgery has always been a thing that has existed, but some of these beauty treatments are becoming more common. So we wanted to do a show on that, just to kind of let you know of what is going on out there. If you haven't heard, so that you can decide, what you might be interested in, or if you just, want to listen for Kokonsa's sake too, we don't mind. We'll just be discussing that. So joining me is Doreen Boamah Okyere. She's an esthetician with our friends Premier Aesthetic Clinic, and she's going to be answering all our questions and giving us all the gist on the treatments and the things. So we are very, very excited. Good evening. Thank you so much for being here.
Good evening. I'm really excited to be here as well.
We too. We are very happy to have you. We are very interested in the gist and the things that are happening out there. So let me start with this. What are some of the most common treatments that women are coming in for these days?
Okay, so if you're talking about the non-invasive,
okay,
yes,
we can start with the non-invasive.
Yes.
Okay.
I think the most common treatments that women are coming in for would be either we call it the liquid BBL.
Okay.
That's what I think the name out there is. But yes, we use fillers for the hip and the butt. And then I would say we experience some lines as we are aging, especially around our nose. We call it the nasolabial line. So women are also coming in for it a lot. Just to feel the line, not for them to look old, but to still look young. Yes.
So BBLs, this is a liquid BBL. It's called liquid BBL.
Right? I think that's the name out there.
Yeah, liquid BBL. And then the facial lines.
Yeah, the facial lines. Yeah, it could either be around the nose, sometimes fillers for the chin and all that. Yes.
Okay. So the BBL, no.
Yes.
You tell us how you do it. Tell us how you
Okay, so I think like you said, we call it the liquid BBL because this time around, we are not taking fats from your body and then putting it somewhere else. Okay. This time around, it's a filler that's being put there. So it's a dermal filler. Fillers are, I would say, they are hyaluronic acid.
Okay.
When we talk about hyaluronic acid, it's already found in our body. It's found in our joints, in our skin. They kind of hydrate and moisturize our skin. Okay, but this time it's made into a gel-like form. So when you put it under the skin, it adds volume. So that is what we use nowadays. So we use fillers for the hip and the butt.
So when you press it, it feels normal. It feels
so right after the treatment, I'll say a few days after, it would feel a bit hard.
Okay.
But after a few weeks, your body gets used to it and it kind of matches with the texture of your skin. So afterwards, it feels normal. It feels normal. You can't tell that something has been done there.
Wow. So you don't have to go through life with a flat bottles anymore.
Well, if you
can afford, if you can, no shade. I'm just saying.
No,
if you
I
can afford, because
yes.
I think it's quite expensive, right?
Yes, these procedures are sometimes expensive. It's the product itself. Good products are expensive, so yes.
Do you have an idea of how much with the BBL?
So depend. Also, one thing is depending on the volume you want. Okay, sometimes it's advised advisable not to go beyond a certain volume. But if you want, I mean, bigger ones, definitely they are expensive. We can expect about 15,000 and upwards. Yes.
Wow, I see. And how with the liquid BBLs, do they last for a long time?
So they do last for a while. Like as it all depends on the product itself. Some products won't really last long, but they can last up to 18 months. Yes, and there are others that can last even more than 2 years.
Okay.
Yeah.
Okay. So the most common is the liquid BBL.
Yes.
And then the facial.
Yes.
So let's talk about the facial. So with the fillers for the face is the same hyaluronic acid.
Yeah, it's the same. Okay, we have types of fillers, but the common one we use is the hyaluronic acid, the HA. Okay, there are other types of fillers that they do not kind of add volume automatically. It induces or stimulates your body to produce collagen and assume a certain volume after a while. So there are other type of fillers, polylactic acid we call it.
Okay. So the fillers are different from Botox.
Fillers are different from Botox, yes.
So which parts of the face do you use fillers for, and then which parts of the face do you do Botox for?
That's actually a very good question. Okay, so most people out there will just go anywhere to have these done, okay, but a very qualified medical professional would know where to put this and where not to put this. So let's talk a little bit about Botox. Okay, Botox are different from fillers. Fillers would add volume. Sometimes it would enhance contouring and also reduce fine lines and some wrinkles. That's what they do. But Botox itself doesn't add volume. Okay. So sometimes when you express, when you talk, there are wrinkles that forms, and Botox goes into this specific muscle to relax these muscles, so the skin on the surface doesn't look wrinkled when you talk. So Botox goes into muscles and relaxes them. It doesn't make them contract. So when you talk, when you smile, some lines that form when you do these things wouldn't be able to appear.
So one of my cousins did Botox a few months ago. Forehead and then eyes, and she didn't have any facial expression because no, that's what happens, right? Because the muscles don't move anymore.
Yes.
So even when she's angry and she's shouting, it's like, it's like a plastic face. I mean, but that's like one of the side effects. I mean, it would take away the
I wouldn't say it's side effects. I would say that, when you are doing these things, we look at the muscle forming the wrinkle, and we target and put certain units into it. Sometimes when you do a lot of units, you kind of eliminate your facial expressions at all. So when you smile, they do not appear. But normally it's supposed to look natural. These things are supposed to, enhance your confidence though, but they are supposed to make you look natural. So when you smile, definitely there should be lines. When you are angry, you should frown and there should be lines there. But then if you overdo this, it would actually take the natural part away from that. So maybe it was overdone. And sometimes before we do these things, we would want to go through with you, know your history and other things. So sometimes you might be taking certain medications, and when you do Botox, it makes it so much effective, more pronounced. So yes, these things can also affect it. Yeah.
And then so I feel like, Botox and fillers, we've heard about them.
Yeah.
But now all of a sudden we are seeing, things like people changing the shape of their eyes. I saw a video where somebody was got profile balancing. I was like, I don't know what that is.
Okay.
So tell us, about some of those. So let's say I wanted to come in and change the shape of my eyes.
Okay, so basically it's not about changing the muzzle where the eyes is, but it's we call it profile balancing. Okay, so sometimes just like your nose, your cheekbone, your chin, they are not actually aligned well. So we can do certain things. We can use these fillers and Botox to make them look really great. It's already beautiful, but we make them look much better. So sometimes when we lift the eyebrow, it gives you a new look, a glow look. Okay, so we can use either Botox or something we call threads. Okay,
the
so
thread,
the pedio threads to lift the muzzle whilst it leaves the muzzle, it gives you this cat's eye look. I think that's how we call it.
So that
or the fox eye look.
So you put thread. So I'm trying to imagine you put thread at 2 points, presumably.
Okay, so that when you say threads, and it's not like the
not
threads
like
we all know.
Not normal.
Yes.
Okay.
So these are dissolvable threads. They are like
Okay.
the sutures that sometimes you do surgeries and you know
okay.
they suture and they're like you don't have to come for us to remove it. It will dissolve by itself. So this is like that. Okay, it anchors into the muzzle. Okay, then we pull. All right, so it tightens the skin and gives you this look. Okay, and these threads are not just any thread. They are collagen stimulators. So after a while, once it dissolves, it stimulates more collagen for that side to assume that's that look for some time. Yeah.
Okay, so I was gonna ask about the length of so it's not permanent.
Most of these treatments are not permanent.
So you have to keep on doing it.
You would have to, yes, sometimes.
You are saying most and sometimes, but which one is not permanent? Which one is permanent?
Okay, so for this non-invasive ones we
yeah.
are talking, I don't think there's any treatment that's kind of permanent. But okay, what you use and your lifestyle would also help you look much better whilst you do these procedures. You know, for Botox, for instance, it can last up to 4 months. But for some people, it could even last to 6-7 months. You understand? Yes, and then after some time, maybe you need to kind of continue with that.
So every 6 months, Botox.
So we give spacing between treatments as well. So
you
it's not every.
Give me space.
Oh
because
no!
If my face is looking, if you've been seeing my face and my face is looking all tight, and then I'm taking a break, then my face has fallen again.
So you know it takes time for the Botox to wear off. Okay, once it wears off, gradually the wrinkles starts coming back. You understand? But the good thing is sometimes they look way better. They don't look as deep as they were before. They look much better. So yeah, you might not need to hurry up and then do another treatment. You might need to maybe give your skin some time to relax. Yes, and that's what professionals like that, like us, we do. Yeah, will advise you to like give time. Most importantly, yes.
So I've seen the thick lips.
Yes.
People doing. So which one is that one?
So mostly with the lips, you can sometimes give it. I would say one. You can add volume, and you can also make it look certain way. Like you see the Cupid's bone. This side around. Dip. Yes, you can make this side big, and then we call it the Russian lips. Okay. So, so yeah, you can do that. Yeah, it can be done with a filler. Okay. So it's funny. For some time ago, having like small lips was like really good.
Yeah.
And now we
yes.
Came and made our lips, and now we want volume. Sometimes people also don't do this because they just want volume. Sometimes their lips are not really aligned, and we can use this to make them align. Okay. Some people would have like get some injury and later would give them a bit of deformity, and then this would also help it. So it's not all the time that people just come in to want to look certain way. Sometimes to correct some other deformities and other things that they've gone through.
You are making it sound nice because I don't know how many people are trying to fix it.
Oh, there are a lot of people that come in for that. Yes. So you see, sometimes, especially when we're talking about the buttons, sometimes people have huge hip dips. Sometimes people even get it from wounds from injection and other stuff, and they try to lift it up. So sometimes it's not all about I want to get bigger hips, but I want to at least look good or feel certain areas that are more, you know.
I guess I have hip dips, so I understand, and I don't know why some people have hip dips and some people don't.
I think when it comes to aging and other things, genetic plays a part. Okay, so genes. Some people already have the volume already, but their hips are just so indented, and other people just have it. All right, so genetics plays a very
a big part of it.
Yeah,
and then procedures like this equalize the playing field.
So
now all of us have hips. Wow.
Yes.
So those are some of the non-invasive.
Yes.
But then we were also talking about the things like the fat dissolving injections. I think I've seen something lemon bottle.
Yes, I think that's a brand of a particular product.
Okay, it's a brand of So what are the fat dissolving injections?
When it comes to fat dissolving, sometimes you have this huge packets of fat around certain areas. You've done a lot, sometimes exercising and everything, but you are not
double chin.
You see especially for us women, the double chin worries us. So the fat dissolving goes in and then breaks down these fat cells. Okay, and the body gets rid of the fat cells as time goes on. So it's something that we do to get rid of tiny bits of fatty area,
okay.
Not like
it's not like lipo. It's not.
No, it's not like lipo.
Lipo,
yes, it's not a substitute, because with lipo it's quite invasive and results are really dramatic. Okay, but with fat dissolving it's gradual. So over the time you would achieve that results, but it's a bit gradual. It's not also really invasive where you have to go under anesthesia and all of that.
Okay, I've seen videos where I think I saw it on your Instagram page or your TikTok, where a woman will come in with quite a heavy set face, so she's quite heavy in the face, double chin and all of that, and then she lies down, and they do some injection, pulling, whatever, and then she comes out and her face is small. What kind of procedures go into?
Okay.
Because also there are some people who are not overweight, but they have heavy set faces.
Yes.
So sometimes they want to. You've lost the weight everywhere, and
but
it's like the double chin.
Yeah.
It's like the weapon that is fashioned against you. Yeah, BBI it doesn't move. So what kind of procedures go into?
Okay, so mostly it's not just one procedure that's mostly being done. Okay, so when you come in and, like you were saying, you have a double chin and you want to get rid of it, sometimes we do the fat dissolving and then we put a tiny bit of fillers into your chin. So your chin also helps covers that part. So sometimes we do jawline. So the jawline give you that chiseled look around your cheeks or around your chin area, and that would make you have that I would say slimmer face that you'd want.
Okay. And then there's the I think I was talking to you about it. You can also do the threading.
Yeah, you can also do the threading. Yes, it's tight. So threading doesn't get rid of the fat cells or the fatty tissue there.
Okay.
It just tightens the muscle and your skin. So once it tightens, you will not see it. Yes, you will not see it as it would be. Yeah.
So the threading is used more for loose skin.
Yes, sometimes for loose skin. Threading, mostly I think it was actually made for loose skin to help tighten an area. Okay. But we've also realized that it would give a certain look. Yes.
Wow, I see. Okay. So those are some of the non-invasive treatments. Yeah. Before we move to the invasive ones, I wanted to talk about some of the skin treatments.
Okay.
Because I've seen I think it's called, is it PRP?
Yes.
So, and then I've seen the one where you there's these little needles, and then you make a lot of holes, and then there's a lot of blood, or you take blood from other places, and then So what are those? What are those ones?
So just like you said, it's the PRP. Okay. So for that, the procedure involves taking the sample of the blood, and we put it in a machine. You see, the blood has white blood cells and red blood cells and other things, platelets. So we take the plasma. Okay, so we filter the plasma out of your blood, and that has a lot of healing factors, and it helps rejuvenate. Okay, so we do that with a micro needling. So the small holes you're talking about, we call it a micro needling. Okay, we create tiny holes in your skin. Like, it's just to tell your body you are hurt, heal the area, and the body just responds by healing the area. So if you have like open pores and other issues, as the body is just healing the area, it's healing these things as well. Right. And once it's infused with the plasma already has the healing factors. It's from your own skin. It also helps rejuvenate the skin as well. So one is for your body to naturally respond to it. So even this is like the most natural thing we do. We are not putting anything foreign. It's just create holes, tell your body you are injured, heal the area. The body responds as it heals, and it's tiny holes, so the body is trying to heal all the areas, produce more collagen than normal, heal area, close open pores. Sometimes even helps with pigmentation and other things. So over time you start looking much better.
So you can't do it at home by yourself?
No, these procedures are not supposed to be. I mean, how are you going to take your blood and put it in them? And we take some amount of blood, okay? So it's not even advisable. With most of these procedures, you do not have to just go anywhere to do them. okay, you have to go to a regulated facility that has medical professional that has undergone training for it, because there are other medical professionals that do not do this. So
and
you
there
have
are
to
people, sorry, I don't mean to cut you.
I
I'm
understand.
agreeing with you. I've seen you see sometimes somebody's doing like a training, 3 days Botox or 3 days filler training, and you don't need any sort of backgrounds. Like you just go and learn how to do it.
Yes.
And then I find that a bit scary.
Me too. I do too. Sometimes I see them often and I'm like, what are you teaching that? I mean,
in 3 days, 3 days. Certified.
Yes, you're supposed to know the anatomy of the facial anatomy, certain areas to put this. Because let me tell you, if you do not go to a regulated place and you just pass through anywhere because of price and other things, okay? So if it's not done by a qualified professional who knows where they are putting these things, you can end up getting some bumpy, getting botched. Even can help with, we call something vessel occlusion. Kind of, you put the solution or the product into your blood vessel rather than putting them under your skin, and sometimes you can even hit a nerve when it comes to Botox, and you end up looking weird. Okay, you end up having eye droop where your instead of your eyes lifting, they end up falling and you start looking really weird, and you can even block a nerve with that.
Yeah,
and that is yes. So that is not good at all. That's why these things are supposed to be done by people that have gone through not just maybe 2-3 days training, but already have the knowledge and they've gone through proper training to do that.
So these kind of, PRP and stuff, are they, you have to do it often?
Okay, so some treatments like the PRP can be done often. When I say often, it can be about 4 to 8 weeks interval, okay, for a number of times to achieve the results.
Then you rest.
Then you rest.
Give your body
maybe
time.
You can give your body more than a year if you think you need it, if you start experiencing these things, because sometimes stress and other things would make you go back, and then you do it. And then when it comes to other, like the fat dissolving, for instance, okay, so we set like let me say treatment plan for you. So you do it for every 2 weeks, maybe for just 3 times, and then after a while you achieve the results. So not all treatments are done often. Yes.
Okay, so my listeners are asking that what is PRP? Because we just jumped into it without explaining.
So that is like getting the plasma of the blood itself, okay? So it's the plasma of the blood. Like I said, the blood has other components, okay? So it has platelets and other things. The plasma itself is what we use for the procedure. So we call PRP microneedling and other things, yes.
So you people that are asking, Doreen explained the PRP. She said that they make small holes in your face. Then they take your blood and the plasma, then they put it inside. Then it makes your body feel like, oh, you're ahead, so it has to heal, create more color. So it's like a refresher.
Yes, we call it rejuvenating. Yes.
So that's PRP. For those of you who were not listening and are asking again that what is PRP?
Yeah, platelet-rich plasma.
Right, okay. Then there's the chemical peeling.
Yes.
And those things.
Yes.
Okay, so what about?
So for chemical peels, they are for specific treatments or specific condition. It's not like you want anything. Some people are experiencing hyperpigmentation, melasma, very bad. They've done a lot of things. So
hyperpigmentation is when there's one part of your face that's
looking
a different color.
Yes.
The different colors.
The different colors, especially around the cheeks and other things.
I have some of the darker. There's a portion of your face that's darker than the rest.
Yes.
So that's
sometimes melasma and other things. So
the melasma too is what?
So it's also another form of hyperpigmentation, but that goes a bit deep. Okay. So yes. And then you can do a chemical peel to remove like the topmost layer of your skin. It removes that part. So the chemicals kind of detach the very topmost layer from your skin, and then it gradually comes off. Whilst it's coming off, it comes off with the pigmentation and other stuff. Yes.
Okay. And it's not harmful.
So mostly it's not harmful.
But
I would say
you shouldn't do it too much.
No, that's why we set treatment plan. Okay, and you don't do it often. It's something that you do it maybe 3 times in a whole year, for that treatment. And once you start seeing better results, you do not go back. So they are for specific condition or specific problems.
Okay. Something I know that a lot of people struggle with is acne.
Yeah.
I mean, so even with me, my daughter has quite bad acne. What are some of the treatments that, usually for acne, we best the pimples and then we
Yeah.
wash with, particular soaps and stuff like that. But what are some of the treatments that can really help, people who are really struggling with acne?
Okay, so some acnes just come as a result of hormonal changes for us women and other things. That's how come you want to know why you're experiencing that particular acne, especially for those that last for a long time. Mostly with hormonal acnes, after a few days or weeks, they just go away. But for acne that persists, they keep coming. You'd want to know the root cause. So, per assessments and history, you're able to know how. Sometimes you might even need to take oral medication itself.
Okay.
Yes, for the acne. Sometimes it will just be a topical cream or something that you need, or maybe you need other treatments as well. Okay, so we can also use laser kind of kill bacteria. So people who have bacteria causing acne, kills bacteria, and then after some time the acne starts going down. So you want to know the type of acne you're having, so you know the treatments for yourself. You don't just go into buy. Sometimes they help, okay, but not all the time. You can buy maybe salicylic acid 2%. Try to kind of let's go of a lot of oils on your face, and that helps. But most of the times you'd want to know the root cause of your acne, so you're able to treat it better.
Okay, that makes a lot of sense. You mentioned laser.
Yeah.
So laser treatment is also something that has
come to stay.
Yeah. Laser hair removal.
Yes.
Especially for facial hairs and
Yes.
stuff like that. So do you want to tell us a little bit about how that works, and then the other things that laser is doing?
Okay, so we'll talk about the laser hair removal. So for that, you see, we say removal, but it's not to kind of pluck the hair out of the skin or something like that. It's so the laser goes into the skin. Okay, there are hair follicles, the root of the hair that produces melanin, brings out hair. It reduces melanin. Sometimes, depending on the type of laser, even kills the hair follicles itself.
Okay.
So over time, you don't have hair follicles for it to like germinate into hair to grow. So that's basically how the laser works.
I hear laser doesn't pick gray hairs.
Yes, because sometimes gray hairs doesn't have the melanin that it's supposed to work on. So that's how come. So people that have gray hairs, we don't recommend
when
you
your
do
facial
laser.
hairs have turned gray. I was plucking some hair and I saw some white ones. So I was like, oh, I can't laser you people. That means you are here to stay.
But I think that, with advanced technology, they are still coming up with a lot of laser, because at first some lasers, you have to do a lot to see results. And now these lasers out there, you can do just one and then you do not see hair for months or weeks. Yeah.
Right. Okay. And then what are some of the other laser treatments?
Yes. So we have something called a fractional CO2. Okay, so that is a type of laser. So it's another rejuvenating laser that you can use that for acne scars. Okay, you develop scars from acne, you have open pores. This laser also works like the needling we're talking about. So the laser kind of micro hits your skin, not too much, tells your skin you are injured, heal it up. The skin does that, produce more collagen than normal, heals the area, bring those open pores and acne scars together, and then heal it. So that's another type of laser out there. Yes, I think there's a new laser that also helps kill fat cells as well. Yes, so instead of doing like a fat dissolving, other lasers can be able to do that for you, and then you see results after a few weeks.
I also saw laser that is also tightening skin.
Yes,
Am I right?
Yes, it tightens skin as well. So there's something called HIFU, okay? So high intensity ultrasound. It also helps tighten skin over time. Yes, there's another type out there.
Hey, right
and
now,
laser can even treat stretch marks and all. So laser is doing a lot.
Laser is, money is doing a lot.
Okay, yes.
Because all of these things, if you are broke, forget.
Well, I mean, they are
expensive.
Sometimes expensive.
They are not sometimes expensive. I mean, they are expensive. Okay, let me take some of our messages so that you can respond to it. The top of the message, please. Okay. In fact, a woman's world is very interesting. Beauty is making our ladies undo their natural bodies, including piercing their ears all over, tongues, eyebrows, nose, and navel. Yes, we like piercings. With what we are hearing and seeing now, our teenagers um, in JHS are going to start doing some of these things so that they can look attractive in SHS. After this, if they want to go to the police, army, fire service, and immigration, it disqualifies them. Some things, I think piercings and tattoos are not accepted, but of course you can, yeah. Anymore, won't all these result in skin and breast cancer? So what are the some of the negative side effects with some of these treatments?
Okay, so like when we talk about the Botox and other things, okay, so the product itself, most of the products, what is made up of our skin already has it, so our body already has it. Like Botox, for instance, okay, Botox is made from bacterium, okay, and it's called a purified protein. All right. Okay. So once it goes in there, you think, oh, I've done Botox, I'm going to get some side effects and all that. Okay, it starts working. After some time, the body breaks it down into amino acids. Our body needs amino acids already. Okay, amino acid, it's helpful immune cells and other things. So it's not something that would harm you later on. Hyaluronic acid, our body already has it. Okay, and this has been made into gel-like. After some time, the body produces an enzyme, breaks it down. It goes and becomes carbohydrates. The body needs it as well. So most of these things are not bad. But then when it comes to some lasers, okay, when you do them too much, you are predisposed to certain type of cancers. I would have to be honest. That's why you'd, even when you're doing the laser, you protect your eyes and other areas, so you are not exposing them to the strength of the laser. So most of the products that we use for fillers and other things, we already have it. Even the IV, I'm sure we didn't talk about the IV.
No, we are. No, we'll talk about it before,
our body already has it. Okay, it's just that this has been synthesized or made into something that would work in another way, but our body already has it, and it gets broken down into useful substances in the body.
Right. Okay. So let's move to the IVs, because there's refreshing IV, replenishing IV, there's weight loss IVs, there's glow IVs, there's all of these things, right? So why do we need, some of these?
Okay, so I mean, there's a lot out there, but I wouldn't talk about those ones, but because those ones are sometimes they are names of tags people give it to other things to sell.
Yeah, that's what I mean. I mean, like honest. They do different things.
Yes, but most of the IV that we know is like, okay, we want the brightening IV and other things. So the IV is constituted of vitamin C.
Okay.
Vitamin C, as we all know, is good. And then glutathione. That's a very good antioxidant. Yes, that actually helps get rid of wrinkles and other things.
And also lightens, I think, but in very high doses.
Yes, in high doses. I wouldn't say lightens, it brightens the skin. Okay, we shouldn't get used to the lightening. I think that's what sells, but it brightens the skin. Okay.
I know that. Sorry, not to go off topic, but I think there was a health scare because some people or some beauty, whatever, they were adding very high doses of steroids to the glutathione, so that people were actually going like shades lighter. But then that's also very dangerous.
Very dangerous. Yeah. Even with glutathione, when you take it in high quantities and high amounts that's not regulated, you put stress on your kidneys and your liver, because your liver already makes glutathione. It's already found in your body. So yes. So when you do these things, you kind of, how do I put it? You stress your liver and your kidneys. Yeah.
So it's not
not good when you do them in high quantities. You understand? So one funny thing that's the side effects of glutathione or unexpected effects is what we use for the IV. Okay, it's supposed to go and help your cells from damage. All right. Even for the skin, there are free radicals that form wrinkles, give you dull skin and other things. And this glutathione would let go of those free radicals, give you an even tone. And then, as you take them in certain amounts, it would help reduce the production of darker pigments. Then you start getting an even skin tone or even a brighter skin tone. Yes. So
okay.
these things, I always say, you have to go to places that know what they are doing. So they do not give you something else or add other things that would, like you're saying, the steroids, so that you'd be fair or get lighter in a few days, and that is not helpful.
Yeah,
You are
yeah,
harming yourself.
yeah.
Yeah.
Is there a safe way? I mean, so a lot of people are changing their skin color. There are lots
Yeah.
of people that are bleaching. Is there a safe way to do that? Because I mean, if you go on TikTok, for example, lots of people are selling all sorts of creams,
Yes.
and all sorts of things. I know that there are injections and things, that people do to lighten up and all of that. I think to reduce the production of melanin.
Yeah.
So from a health, I'm not asking you to endorse or to say, whether it's right or wrong, but from a healthcare perspective or from a health provider perspective, is there a safe way for people who want to do that?
Okay, so I think first of all we should really accept how we look. Okay,
But if we
these
accept
things
how
are
we look, we
these
won't do
these
Botox.
things enhance it. Oh no, these things enhance your look. You accept yourself. When there's something wrong, then you fix it. It doesn't mean you do not
so
like
maybe
how you
what
look.
is wrong is that I'm too dark.
I understand.
And I
you.
don't like
I think
it.
first of all we need to be confident about our skin color. There's nothing wrong in being dark. I mean, being fair is nice, but there's nothing wrong
I mean,
in being
being
dark.
dark is beautiful.
It's so
too,
beautiful too. Okay, so I would say that the safest way you can, maybe I wouldn't say lighten or kind of even out your skin tone or brighten up, is to maybe do these IVs. Okay, and these IVs, like I was saying previously, you have to go to a regulated place. Okay, with regulated places you don't get, I mean, light overnight.
Like three
No, you
shades
have to.
lighter
No,
in 2 months.
2 months it doesn't happen. Okay, because they give you the amounts that your body need at that moment. Okay, they add vitamin C, boost your immunity. Vitamin C already lightens or kind of brightens your skin, and they add the glutathione in quantities that are supposed to work for you. I mean, for a number of weeks, and then you start, and it won't even lighten you. I would be honest, these things, they brighten your skin, they don't lighten, except somebody is putting in something that you don't know.
Okay,
it will not lighten you. You have to take glutathione in excessive amounts for the side for it to lighten you, and that's even is stressing you're stressing your kidneys.
So so moving to some of these beauty products. So there's things like not hydroquinone. There's, I think, alpha arbutin, glycolic acid.
Yeah.
These are over the counter.
Kojic acid and those things.
Kojic acid. But for example, the company Ordinary has like glycolic acid
in their products.
Yeah, so like even like an exfoliating
Yes,
glycolic acid, which you can use maybe for darker areas. So if your armpits are a little bit dark, stuff like that. I've seen alpha arbutin. There's another one called, I think, AHA.
Yeah.
Which is for brightening and all those things. And these are sold in like drugstores. So for example, if you go to the UK, they're sold in like, the Tesco's drugstore, or I don't think Boots is still, I think Boots and, pharmacies and stuff like that. Are they safe? I mean, those ones have like FDA approval. They have like, are those ones safe? So for example, if you want to use the glycolic acid, to exfoliate your armpits or to, deal with a little bit of hyperpigmentation,
Okay.
are those ones?
So I would say those ones are safe because they are made in quantities that, and they are like guidelines that you use
guidelines
this,
that they follow.
Yes, you have to follow. Use this twice, or sometimes you can even use any other day. Sometimes you can use it 3 to 4 times a week. You don't use it every day. So those ones are safe. And there are other ones that you have to like get a prescription for it to go and get it. So those ones are highly dangerous, or sometimes when not used well could cause you harm rather than good. So you have to really need it for you to get a prescription to go get it. But most of these ones are actually safe. Okay, they would help brighten, sometimes like you're saying, exfoliate. As it exfoliates, it takes some darkness and other things around the underarm away, and then it's when you use it properly, I would say it's fine.
I think the really scary ones are the creams and serums that the whole thing is in a language you don't understand.
Yes, and we are ready to get it because of the whole hype out there.
Yeah, you go into a beauty store, you pick a product. The whole thing is I don't know whether it's Arabic or sometimes
Yeah.
some of them are from some of our neighboring francophone
Yeah.
countries.
The Korean ones that we are jumping all over for.
Yeah, the kojic acid, and
Yeah.
the pictures are on it, and then you notice that the around the bottles have started going brown. So
Yes,
you
when you
colour
open it for a
changing
while, yeah.
and all these things. And these are dangerous. I mean, when they
Yes.
start showing
Well, some
these kinds
products
of,
are not supposed to kind of, you don't
be
you're not
exposed to the
yes,
sun.
so that's kind of
Okay.
oxidize it. So it doesn't necessarily mean
It's
it's
dangerous.
dangerous.
It's just that.
But it's, one thing that we have to know is when you're taking something orally or you're taking a medication, you want to read a lot. So when you're putting something on your
The
skin,
skin.
read a lot too.
Because it
Sometimes
absorbs
the
and
fact that
it's-
it's working for someone doesn't mean it's going to
It's
work
going
for
to
you,
work for
or
you,
you
yeah.
need the same thing. Okay, so we would have to really read and be inquisitive. We want to know more. It's not because so TikTok or social media is jumping all over, so you want to get something like this, and it has to be really for you. Okay, yes.
Right.
You know, there are some products that when you are breastfeeding and other things, you're not even supposed to. But then, if you don't know, you just go and buy it on the market and just use it.
and then it could harm.
You and probably your baby as well.
Yeah, we didn't get to talk about some of the invasive procedures.
Yeah.
But maybe we can run through them quickly. We have
Okay.
about 7 minutes.
Okay.
So, what are some of the more invasive procedures that are available?
Okay, so I would say the more invasive procedures that we all know, I think, would be the liposuction and the fat transfer that we call is the BBL. Okay. So liposuction, taking away the fats around a specific area. Okay, and then the transfer would be making the fats into a transferable solution that can stay when you put it to assume a certain volume. So I think that is more like I think that's what
That's
most
really
people are.
what it
Yeah.
is. I think let's talk about breast, for example.
Yes.
I think when it comes to breasts, apart from the implants, the silicone implant, I don't
Yeah.
know if we've made any more, because you hear about all these liquid BBL and fillers and stuff for.
Oh,
but
there are
not,
fillers specifically made for the breast as well.
okay.
Okay, and then you can also transfer fat into the breast as well.
Okay.
Yes.
Okay.
And even with the breast, there are other ones that are breast reduction surgeries also out there,
Okay.
where sometimes the breast is really big, giving you back pains and making you not feel good, and then you can also kind of reduce it. So
Okay.
sometimes it's not just to have the bigger
bigger
breast
ones
and all
and
that.
the-
Sometimes it's to also reduce back pains and some troubles that
The-
some
yeah, it's
women
a bit-
face. Yeah.
Okay, this one says, did I hear it said that one can buy breasts and buttocks and other body parts? May I know whether the breast for sale will make a woman breastfeed a baby better? Let me rephrase that question.
Yeah.
When you do work on your breast, for example, does it affect? So, for example, if you did a fat transfer or you did a breast suitable filler, will
Yeah.
it affect your ability to breastfeed?
Mostly wouldn't.
Okay.
If it's done really correctly, it wouldn't. Okay. So everything is intact. Okay. The fat or the filler is put into a certain area that would just give you volume, not to kind of distract your anatomy or put them in other places. So you'll be able to sometimes when it comes to the implants and other things, that's where it mostly gets difficult to breastfeed and other things. But these fillers that the body absorbs or kind of dissolves over time, you can be able to breastfeed.
So it shouldn't be
No a hindrance or anything
a
at all.
hindrance, okay.
Yeah.
So if we want to, this is my last question.
Yeah.
When we start saving, how much a month? Let's say we have to save for 1 year to be able to come and do. We want to do liquid BBL and then a little bit of Botox, a little bit of filler, a little bit of laser to tighten our face, and a little bit of breast fillers. And stuff. How much? Like how the savings, we should start from where? Because I know you won't give me specifics.
Yeah, but before
But-
I go to that, okay, I mean, as we are talking about these things, not everybody needs it. Okay, not everybody needs it. Sometimes people get so used to how good they look when they do these things that they want perfection. They seek perfection, okay? And that's where we as health professionals, we come in, we help them, we let them know that beauty doesn't mean you have to stress yourself, okay? Just believe in who you are. Beauty comes from within. Be confident and you're okay. So that's what I would say. Not everybody. People would even come to us looking for something that even if they do something about it, the person herself can't even note the difference. Okay, so sometimes too it's psychological. So there are, for other ones we can also let you see someone who would help you with that. So for, I'll say, depending on what you're doing, if either you want to do a Botox, no, it's not everybody that needs Botox. Once you are young, wrinkles are not there. You do not need them. Okay, so not everybody needs it, but at least for Botox, maybe around 1,500 to 2,000 and maybe and above for Botox. Sometimes the same amount for fillers as well.
Yeah, it's not too bad.
Yeah,
we'll start the savings now. Thank you so much.
Thank you so much for having me,
for joining us. And Doreen is from Premier Aesthetic Clinic. Do you want to just share your Instagram and TikTok handle so that if people want more information?
Yes, so we're on Instagram, Premier Aesthetic Clinic. You can follow us. You see more of what we do. It's not just about what you see. Sometimes you can come to us, and then if you need something, looking at your face, if you need it, would recommend. If not to, maybe after a few years you start getting wrinkles and you need it, but you can come to us. We do a lot. So aside the fillers and the, like you said, we do facials and other stuff. We do skin treatments. So if you want to come in, you have this condition, like we're talking about the acne, and you want to really treat it, you can come to us. We have other options available that will go through with you and then choose what's most suitable for you. So we do all this. We do the invasive ones as well. So you'd also come in, see our plastic surgeon, go through with you, see if you're an ideal candidate for it, and then you can actually take it from there.
All right. Well, thank you so much. So your social media handles?
Yes, so Premier Aesthetic Clinic on Instagram. You see us and then you follow us. We have our numbers out there, and then you reach out to us. I think we're on TikTok too, Premier Aesthetic Clinic on TikTok as well. Yes.
Premier, so Premier. Aesthetic is AESTHETIC. So Premier Aesthetic
Clinic.
You can find them on Instagram and TikTok and Facebook, right? But mainly Instagram.
Yeah, mainly Instagram and TikTok. Yes.
Yeah. All right. Thank you so much.
Thank you so much for having me. It's
when I come and do my things.
It's been an exciting segment. Yeah.
Thank you so much. It's been very informative. You've given us so much information. And hopefully we'll have you on again another time. And greetings to your boss.
Thank you so much for having me.
All right. Well, I hope if you were listening, you learned something, and maybe you have something to save towards if you are interested in any of the things we've spoken about. I mean, it's ours to give you the information, and of course, it's yours to decide what you want to do with it. My name is Animwaa Anim-Addo, and it's been a pleasure to bring you this show. God willing, we'll be back next week. A big thank you to Anita and Oliver and the rest of the team. I'm really missing Mirabelle, but I think she's on some prayer mountain somewhere, so we'll just give it to God. But thank you so much, and see you next week.